In this video, let's meet the thyroid gland located in our body. The thyroid gland is a butterfly-shaped gland located at the front of your neck. It has got two lobes, the right lobe and the left lobe, which are connected together by a thin tissue called isthmus. You can visualize the location of thyroid gland by this demonstration. It is a butterfly-shaped gland which weighs about 10 to 20 grams. Although it is small, it has got major roles in controlling metabolism of our body. It synthesizes three major hormones, T3, T4 and calcitonin. Now, let's talk about the most common disease associated with this gland, which is hypothyroidism. Now, let's know about hypothyroidism. What is it? Hypothyroidism is a condition where the thyroid gland does not produce enough thyroid hormones, that is T3 and T4. If you are having hypothyroidism, consuming certain foods can interfere with thyroid function, hormone absorption and iodine levels, making the symptoms of hypothyroidism even worse. So, what are the list of such foods? Let's talk about that. Number 1. The food that should be eaten less in hypothyroidism are goitrogenic foods. These foods contain goitrogens that block iodine uptake, reducing thyroid hormone production. As you can see here, cabbage, broccoli, radish, mula in Nepali, cassava, tarul in Nepali, and Brussels sprouts. This comes under goitrogenic foods. Try to intake cooked version of these foods rather than raw, as it reduces goitrogens, and try consuming it in moderate quantity only. In number 2, we have soy-based foods. These foods contain chemical substance called isoflavones that inhibit thyroid peroxidase enzyme and interfere with medication absorption. So it makes hypothyroidism even worse. What comes under this? Edamame, bhatmas in Nepali language, soya milk, tofu, and miso, which is popular food in Japan, comes under it. Try to limit consumption of this soy-based food, especially near the time when you are taking medicines. In number 3, we have caffeinated beverages. It actually reduces medicine absorption, increases anxiety and palpitation. Let's look at these foods. Foods like coffee, cold drinks, and strong tea comes under it. Try to avoid excessive consumption of these foods. Alternative choices can be decaffeinated drinks and herbal tea. Avoid sugary, refined, and highly processed foods. It may lead to insulin resistance, weight gain, and increases blood pressure as well as edema. You should avoid excessive consumption of these foods. Foods like cakes, pastry, canned foods, fast foods, and other junk foods should be avoided as far as possible. Avoid alcohol consumption. It inhibits peripheral conversion of T4 to T3. This further decreases the level of thyroid hormones in your body, making the symptoms of hypothyroidism even worse. Minimize gluten-containing foods. They may trigger autoimmune response in hashimoto's thyroiditis, so it increases the risk of infection and inflammation. You might be thinking, which food contain gluten? Foods like wheat, barley, and pasta have high amount of gluten. You should limit intake of these foods as far as possible. Alternative foods that are gluten-free, like rice and oats, can be used. Lastly, reduce consumption of deep-fried and red meats as well as unhealthy oils. Try to consume healthy fats like olive oil. Studies have shown that limiting intake of these foods have positive impact on treatment of hypothyroidism.